Hi, my name is Kalani. I'm a student physical therapist. Sorry, that's my dog. At Midwestern University, and I'm just going to take you through some joint mobs and special tests. First, we're going to start off with the central PA glides of the cervical spine. This is my patient here. His name is Jonah, and we're going to just assess the springiness of his joints up in the spine here. Okay, so first, I'm just going to have him rotate his head. We're just going to kind of feel around, assess the joint mobility first, and then we'll take him through the grades. So the way I'm going to do this is I'm going to put my thumb over my thumb on the spinous process in the central PA. So I found C2, just general. You doing okay?
I can't breathe.
Okay. Okay, kind of stiff. So now we're going to do grade 1, which is 0 to 25, just a small little palpation here. Then we're going to do grade 2, which is 0 to 50, which is a little longer. Okay, feels a little bit less stiff there on that one. And then we're going to do grade 3, which is also a little longer, so it's 50 to 75. Take it through that joint range there. On grade 4 is you go all the way to 75, and then shortly you do it in between 75 and 100% of their range of motion. So that is a central PA glide, and those are the grades. All right, so this next one is a side glide, and so I'm gonna assess his joint mobility basically this way and this way. You're supposed to do it bilaterally, but for the purpose of this video, I'm just gonna show you on one side. So with my patient, I'm going to palpate the transverse processes. I'm gonna kind of take my hand, slide it under the neck, and my other hand is stabilizing. If I'm doing a left side glide, I'm gonna push from the right to the left, and if I'm doing a right side glide, I'm gonna push from the left to the right. So, palpating for that C3. Again, we're gonna do a left side glide, pushing that way. Stabilizing. Pretty good. And just for kicks and giggles, I'll do it on the other side. So you can see my stabilization hand. And pretty good joint mobility there. Okay, so for this next one, we are going to do some special tests. So we're gonna start with the distraction test. And for this test, we're looking for if the patient's symptoms are alleviated, since we would be decompressing their compression. And so how to perform this test, so I'm right here. I'm gonna take the back of my finger. Here, I'll take this ring off for you. The back of my fingers, I'm gonna go right under the spine, and my other hand is gonna come right here. I'm getting in a good body mechanic position so that all I have to do is lean back and pull. How's that feel? How's it feel?
Good.
Good. And we'll bring them slowly back down. And that's the distraction test. All right, so this next special test is we're going to do an upper limb tension test with emphasis on the median nerve. So for this test, we're going to see if our patient has any neural tension along that median nerve line. And welcome our other new patient, Bandit. And so basically, we're going to take Jonah through a various amounts of different positions to kind of see where the tension lies. So the first one, we're going to put the shoulder into 110 degrees of flexion, and then you're going to come down and make sure you're putting a little bit of blockage on that scapula so they don't go all the way up. Then we're going to externally rotate. How is that feeling?
Good.
No symptoms there?
Nope.
Okay. And then we're going to put the patient's hand in supination. No symptoms there? Okay. And then we're going to extend the wrist and the fingers. Any symptoms there?
No.
Okay. And then we're going to go all out. You just let me know if you start to feel it, or when you start to feel it, okay?
Okay.
Slowly.
Starting to feel it there.
Okay, and then we're going to take it back. And we're going to go all the way out. Tell me when you start to feel it.
Starting to feel it there.
Okay, now what I want you to do is put your ear onto your shoulder. Yep, the opposite way, good. Does that increase or decrease pain symptoms?
Increase only a little bit.
Okay, and then come back to neutral. And now go towards it. Anything?
Nothing.
Okay, and back to neutral. Perfect. So with what we tested with our patient, he has a little bit of neural tension. And when going away, it will increase that tension even more. And yeah, so his positive findings came very late towards the end of the test, so we wouldn't be too worried, but we would still want to try and decrease the tension that he does have. Also, for this test, we would test bilaterally, but for the purpose of this video, we did it only on one side. Alright, for our last test, this is going to be the Sperling's test. So we would use this test when we're looking for any radicular pain or any reproduction of symptoms. Down the arm, we're also looking for if the pain is increased or decreased. And a positive test finding for this test is if the patient has increasing pain with the compression. So there's a couple different positions, and I'll show you both. So this one, I have my patient, Jonah, here. He's going to sit here, and all that I'm going to do is clasp my hands together and push down on his cervical spine through his head. Okay, are we ready?
Ready.
All right. We'll push down. Any symptoms with that?
No.
Okay. And now we'll try a different position. And so say that Jonah had right-sided issues or mobility deficits or cervicalgia. He would extend and look up to the right, and I would crush down, not crush, but push down on this side. Any pain there?
Yes.
Yes?
Right there.
Right there. Okay. And that's because we're closing down the gap even more, and that would be a positive test finding. And then for this test, we would want to test bilaterally. We would do the unaffected side first, and then we would show the affected side next, just so we have a baseline.